Similar with nutrition and diet and exercise. Help yourself do these simple things that you don't need a GP to give you something for, and you're going to see the results. My name is Dr. Omar Iqbal. I'm a locum general practitioner, which means that I'm not affiliated to one practice, and I work all over the south of the country. And I have a keen interest in bodybuilding, and that stemmed from an injury I sustained about 12 years ago. I would say not a great deal. Through the medical course, I mean, there were a few lectures, possibly a few tutorials centered around nutrition, but I wouldn't say it was weighted at all to that really. And even now in general practice, I don't think we spend enough time with our patients talking about nutrition. It's just the repetitive nature of what I see, and that's what I see, is that prescription-seeking behavior. Give me something that's going to help me lose weight. The easy option. The reality of this is that it's difficult. I always say that to my patients. Losing weight, dieting, is difficult. The more enjoyable we can make it, the easier it's going to be, but it's still going to be difficult. Because if the patient can help themselves, they can find that sort of motivation to sort of make sure that their diet's clean and balanced and healthy, they're doing regular exercise, that's where the results are going to come. No drug is ever going to, in my opinion, ever going to come out that's going to beat that. In my experience, the majority of the time, the patient wants something that's going to do this for them. They've come to you for you to do this for them. I can almost liken it to one of the most common things we see in general practice, which is an upper respiratory tract infection, or a common cold, a sore throat, or something like that. The amount of patients I have coming in wanting antibiotics, they're not seeing the bigger picture and the fact that they can help themselves. Conservative measures, let your body fight it off. Similar with nutrition and diet and exercise. Help yourself do these simple things that you don't need a GP to give you something for, and you're going to see the results. And I'm going to say again, this is me being very honest, GPs, I think, with the time pressures and the other pressures they're under, are probably partly to blame for that as well. Just giving a prescription, getting the patient out the door so I can move on. Sitting and talking to a patient about their diet, their lifestyle, their exercise levels, that takes time, and time's something we don't have. In an ideal scenario, number one, if we had more time, whether this is feasible, I don't think so, but if we had more time, had that extra sort of 5 minutes just to have a chat about the patient and their lifestyle, what's their diet like? What are their sort of physical activities like day to day? What is their energy expenditure? Sit down and make a little bit of a plan with them. I think that would be of tremendous benefit. Mental health. Absolutely. Anxiety and depression, I'd probably say the two most common things that I see. So out of 18 patients, I would hazard to guess at least 4 or 5 will be mental health. It's a common feature in all my clinics, and that's why I think it's so important about lifestyle medicine and diet and exercise and the beneficial effects it can have on mental health. That brings on to something else with regards to mental health as well, is giving them a prescription. Here's an antidepressant, take this, go away, and you'll get better. Do they help? Evidence suggests yes, but I certainly think we need adjuncts with that. And those are the addressing your lifestyle and your diet, your hobbies, exercise. Those are the things that I always feel just sort of take a back seat, and it comes down to, again, there's the prescription. The most common one is probably how do I lose weight? I want to lose weight. Tell me how to do it. And unfortunately, I've spoken to my colleagues about this as well, and the underlying response from patients is they want something easy. They want something that I can go and do, and this is going to happen overnight. And unfortunately, that's just not the case. And I think that's why we struggle as GPs to sort of engage patients in doing regular physical activity, dieting to lose weight. And it's the failure to establish those healthy relationships with food and exercise, which is a big factor in, I think, why we struggle to sort of get our patients to lose weight. It's always a question of how do you have the time to do that? How do you have the time to go and train and focus on sort of how you look and your diet when you're in such a stressful, demanding job that takes up so much of your time? I get asked that so much by colleagues, by patients, by staff at the GP surgeries, and my answer is usually always the same. It's the fact that the training is my hobby and I enjoy training. If I didn't enjoy it, I don't think I'd be in this position. And that's why it's so important to try and make exercise enjoyable for patients in any way we can, okay? Because if it's seen as a chore, which I think it often is, it's going to be possibly done for a short period of time, and then it's going to get bored, it's going to fizzle out, and it's not going to be sustainable. We have to find a way to make it enjoyable for the patient, develop a healthy relationship with exercise, and exactly the same with diet. So for the time being, I'm going to stay in South Wales as a locum GP. The stability of the NHS is a little bit of a problem at the moment, so I can't see myself committing to any sort of long-term practices, which I do want to do eventually and go into a partnership. So that will mean I'm essentially a business partner in a GP practice, and I'll be able to develop that continuity of care with patients, follow them up, and that sort of lifestyle sort of side of medicine will become much easier because I'll be able to almost track my patients' progress. That's the dream, but you know, as I say, short term, I can't see it happening with how things are in the NHS, but that's what I'd ultimately like to do.